Good afternoon. I'm Tanya Winders, President and CEO of Allergy and Asthma Network. Today, we're excited to be talking about creative approaches to routine asthma and allergy care during COVID-19. Allergy and Asthma Network has been dedicated to the same mission since 1985, to end needless death and suffering due to allergies, asthma, and related conditions through our 4 mission areas: outreach, education, advocacy, and research. We welcome you to the 13th in a series of special webinars apart from our usual Advances in Allergy webinar series. This series has been developed to address the unique issues related to COVID-19 coronavirus. I'd now like to introduce our speakers for today. First, Dr. Jackie Agaray-Sabet. Dr. Sabet is a board-certified allergist, immunologist, and pediatrician, and is the director of telehealth for Allergy and Asthma Network. She is the founder of Family Allergy and Asthma Care, where she was in private practice treating children and adults since 1994 in the Metro DC area. She has served as medical contributor for NBC News in Washington and has co-written multiple magazine, newspaper, and online media health articles, and is a principal investigator for the FAR Institute, conducting phase 3 and phase 4 clinical trials. She is also clinical assistant professor at George Washington University School of Medicine, where she mentors the next generation of doctors. Dr. Agaray-Sabet is the president of White Coat Resources, a health education consulting service that helps connect patients to therapy through innovative medical messaging and education. Next, I'd like to introduce Dr. Parikh. Dr. Parikh is an adult and pediatric allergist immunologist at Allergy and Asthma Associates of Murray Hill. She is currently on faculty as clinical assistant professor in both departments of medicine and pediatrics at NYU School of Medicine. She's passionate about health policy and serves on the board of directors of the Advocacy Council for the American College of Allergy, Asthma, and Immunology. She frequently travels to Washington, D.C. to influence policy, testify, and advocate for her patients on behalf of the organizations like Allergy and Asthma Network and the United Nations Foundation's Shots for Life. Dr. Parikh is a spokesperson for Allergy and Asthma Network and frequently makes appearances as a medical contributor on our behalf to NBC, Fox, CNN, Wall Street Journal, and CBS. She has her own monthly column in U.S. News and World Report. And as a resident of New York, Dr. Parikh has been on the front lines of the COVID-19 outbreak and has unique perspectives as she's also researching, conducting the research for the vaccinations. So this is an outline of what we are going to cover today. As we always do, we'll start with the current state of COVID-19 affairs. Then we will turn our focus to in-office care strategies in allergy and asthma care. Then we'll hear specifically about new and creative approaches from Dr. Sabet. And then finally, we'll wrap up with some of the latest facts and myths around COVID-19 and test your knowledge to see how many facts and myths you get correctly. So as we get started today, we'd like to first just start with a poll. We'd like to know who's here today, and we'd also like to know what title best describes you. So you can see the poll now coming up. If you will select one of the options that best describes you: physician, nurse practitioner, PA, school nurse, respiratory therapist, asthma educator, or patient. Give everybody just a few moments to place their response, and then we'll see who all we have on the line. Everything's being tabulated here. Looks like we've got about 2/3 to 3/4 that have placed their answer. Give it just about 5 seconds and then close this poll out as we are close to 80% response rate. Thanks everybody for participating. We think this makes it a little more interactive and fun, so hope you'll find it to be the same. Okay, we're gonna go ahead and close the poll now, and let's see our results. So we do have a multidisciplinary group on the line, but certainly school nurses, and respiratory therapists win with about 80% of those who responded. Thank you for sharing that today. All right. So what is the current state of COVID-19? Again, we always go to the Johns Hopkins Coronavirus Resource Center for our latest statistics and numbers. And you can see here that the global cases are inching ever so close to 30 million at this point in time as we approach mid-September. Also, unfortunately, the mortality rates due to COVID are inching ever so closely to 1 million as we come into the 6th month of this pandemic. And what about here in the US? Again, we use the CDC numbers here to show us exactly the total case number. As of yesterday, almost 6.5 million total cases, with an increase of 40,000 reported in just the past 24 hours. And again, inching ever so closely to about 200,000 total deaths attributed to COVID-19. Interestingly enough, we are still seeing many cases reported. As you can see, we've had about 250,000 cases reported just in the last week alone. So what are the headlines regarding COVID-19 today? Definitely, the World Health Organization reported that we have a number of vaccine projects that are continuing to advance and move forward, 145 in preclinical, 22 in phase 1, 13 in phase 2, and 9 in phase 3. We did have a headline around AstraZeneca's COVID-19 vaccine trials, in which one volunteer in the UK had a serious reaction or medical issue that resulted in them suspending the trial. However, this is an unprecedented action when it comes to vaccine trials, and in fact, the trial was put back up and running today. So while it was put on hold late last week, it is back up and running today, according to the news reports. So what about the COVID-19 cases trend line, day by day, week by week, as we've been looking over these last 6 months? You can see that we're very pleased to see the downward trend line that continues here throughout the first week of September. Again, there is some concern that as we come out of the Labor Day holiday and into the second week in mid-September and moving into the traditional respiratory season, that we may see a second wave. But clearly we are on the decline of the current peak wave in mid-July. Also in the news, California governor actually reported the lowest daily case count in almost 4 months in California. And the CDC national forecasts predict a likely increase in the number of new hospitalizations per day over the next 4 weeks. 3 forecasts actually predicted a likely decline, and 1 forecast was uncertain about the trend. So there is a lot of uncertainty about what's to come in the coming month ahead. But for October 5th, the forecast estimate 1,600 to 6,000 new COVID-19 hospitalizations per day nationwide. The CDC also updated its mask policy and recommendations over the last week. CDC now says to wear a mask in public settings around people who don't live in your household and when you cannot stay at least 6 feet apart from others. It's important to wear the mask over your nose and mouth and secure it under your chin. Again, each time that we're together with these COVID-19 webinars, we like to remind you of the wonderful resource center, information center that the Allergy and Asthma Network team has developed. Here you can find updated resources and guides for schools as well as for patients and families and providers. So now we're going to go to our next poll question. How have you received your medical care during COVID-19? Let's launch that poll and have you respond at this time. traditional office visits, telemedicine, both office visits and telemedicine, or some other formats. We'll keep the polling going. We don't have a very high response rate on this one yet, so we'll give it just a few more seconds. Everybody log in. We probably should have had a have not sought any medical care during COVID-19. If you're one of the lucky ones who have not had to see the doctor over the last 6 months, or perhaps if you've put off your routine care visits, which is not recommended, we'll probably discuss that a bit later today. But definitely it's interesting to see. We've got about 75% that have now responded. So we'll give it just another couple of seconds and we'll close this poll and share the results. All right, let's see. So it looks like that 30% have had a traditional office visit in the past 6 months, 19% have experienced a telehealth visit, and 46% have experienced both an office visit and telehealth, and then 6% other. So very interesting. Again, a significant shift and change in the rapid adoption of telemedicine and telehealth over the last 6 months, for sure. Thank you for providing your feedback on that. So now I'm going to turn it over to Dr. Parikh, and she's going to share with us some of the in-office care strategies. Dr. Parikh.
Thank you. So, this is definitely a challenging time for both patients as well as, physicians and office staff because, for the first time in a long time, we are, having to protect everybody that comes in and out of an office. So, the office environment is very different than what we're used to. We now have kind of a socially distanced medical office experience. So appointments have been staggered. There's been barriers. It's not uncommon to see plexiglass at the sign-in or reception. There's a lot of signage, masks on everybody, patients as well as staff. And, there's a lot of new screening procedures in place. Some of these appointments, too, may be more challenging for some, as I know a lot of offices and facilities are limiting family members and others you can bring with you. So how do we keep things personal when we're trying to be distant? So first and foremost, we want to make sure that our office staff is well protected because, if they fall ill, they're unable to care for all of you. And so that includes having appropriate PPE, which I know from personal experience was a big problem early on in this pandemic. Luckily, that has improved significantly. Stringent cleaning protocols, so very deep disinfection between each patient and at the end of the day. And then precautions for the staff. So separated workstations for social distancing, mandated masks, and then cleaning of patient rooms and staff workspaces. And again, patient screening is extremely important because one sick patient can easily infect everybody in the office setting. So that includes questionnaires before people come in, temperature checks, etc. And everything now is a risk-benefit assessment, from picking up your groceries to even considering attending school again. So similarly, in the office setting, everything's also a risk-benefit assessment. So things that are considered low risk are biologic therapies, getting your immunotherapy or your allergy shot, skin testing, as well as patch testing to help us diagnose what you're allergic to. Things that are considered medium risk are food challenges, drug challenges, and some skin testing in very young children. Now, the high-risk procedures are for most of our asthmatics, and these are what we call aerosolizing procedures, and procedures in which people might be spreading secretions or sending secretions into the air, which could infect other people. So that includes spirometry, nebulizers, exhaled nitric oxide, peak flow meter measurement in the office, and patients demonstrating their MDI technique. And important note is these high-risk procedures, most allergists, pulmonologists, internists have limited them significantly, which is good to protect others, but it puts us in a challenging situation because a lot of these are objective measures to help us assess your asthma control. And it's helpful, you know, because we like to train our patients on how to properly use an MDI. A lot of this, unfortunately, we're not able to do in the office anymore, or very limited. So, you know, when COVID-19 numbers rise, you know, reduce office visits. Luckily, depending where you live, this can change. Luckily, in New York City, we've been below a 1% infection rate since about June, thankfully. So right now is an opportune time if you live in the New York or tri-state area to get your doctor's visits in, your elective procedures in. But, you know, that may change very quickly. Or, you know, depending in which area of the country you're in, it's important to pay attention to what your local health officials are saying. Again, if you're running a temperature, do not come to the office, you know, stay home, call your doctor, cancel any non-essential appointments. And then, you know, we're now spacing out our allergy shots to every 2 weeks instead of weekly to minimize exposure to staff and the patients. And patients receiving a biologic medication still do need to come in, but some we've been able to give it less frequently. Some people we've been able to transition to home administration. So there's a lot of options. And then oral immunotherapy is a great option as well if you're an appropriate patient, and that's something you should discuss with your physician. So what are some creative solutions? You know, as they say, in crisis comes opportunity, and this crisis has definitely forced us to be very creative and innovative. So now it's not uncommon to have electronic or phone check-ins upon arrival at the office. Many offices are having patients wait in the car until you can be seen. That way you're not waiting in the waiting room itself. Also forms or any payments, many places are doing electronically prior to arriving, so that way you don't have to worry about it and taking money or credit cards out. And then some allergists are even giving shots in the parking lot. And having patients wait in the car. So essentially a nurse comes out with the immunotherapy, administers the shots, and then you have to sit in the parking lot for 30 minutes, but at least then you're in your own car, in your own space. And then of course, opening windows if possible to avoid, you know, ventilation problems and airflow, because we know what happens is COVID spreads very rapidly in enclosed spaces where there's poor ventilation and poor airflow, especially near the areas of the office where you're doing spirometry and those high-risk procedures. Now, this will definitely be more challenging as we move into the winter months, but at least for now, while most areas of the country have reasonably good weather, this is an option. And I know many offices are looking into creating ventilation systems so that going forward, they don't have to worry. And we say this in every webinar, but it still holds true today. The only thing that is constant during this pandemic is that everything will change. And, you know, we have to be adaptable and we have to be, you know, open-minded to that. And then I'll hand it over to Dr. Jackie now.
Constants, and that would be these three topics here. So let's talk about how confusing life has become. Next slide. Let's talk about just exactly how confusing life has become and how really COVID has made life unrecognizable. And particularly what I'm talking about in terms of those constants are those touch points that we so need. And even in the midst of this virus, if we can have those constant touch points that help us organize our health, and particularly those reminders to be able to stay on top of our health. So the first one we're going to concentrate on is the calendar. And we are here just a few days away from the fall. In the old days, meaning last year, the fall would have meant fall allergies. And it still does mean fall allergies, but there's definitely a 2020 twist to it. In some parts of the country, the main pollen allergy was ragweed, and that is still true, but there's some people now that are getting more ragweed exposure than they ever did, and some people are actually getting less. So think about it. Those football players who aren't out there doing those 2-a-day practices, and those soccer players who are presently sidelined, they're going to be getting less exposure because they're not out on the field where the ragweed blows about. But think about those kids who are actually having outdoor classrooms, or who they are in their classrooms. And as Dr. Parikh had talked about, you want to keep the windows open. So now you're getting far more exposure to the outside than you ever did in 2020. So what are the best ways to go ahead and combat ragweed? Well, it's always what we allergists talk about: avoidance, avoidance, avoidance. And the first way you can do that is just filter the air with the air conditioner when you can, and certainly shower and rinse off the pollen before you go to bed, especially if you have been in an outdoor classroom or you've been keeping your windows open quite a bit. And please, if you have allergic asthma from ragweed, which is so common, and one of the #1 times that we see asthmatics actually end up in the ER and needing to go on rescue medications and oral steroids, it's from ragweed. This is the time you have to stick to those maintenance medications. One of our common customs, and that's another one of our constants, really has always been that nationwide ritual of back to school. But this year, back to school really just meant back to the dining room table or the kitchen table with the computer, and we're back at home. So where we used to gear up to go face all those dust mite laden schools, now we're actually just staying at home. The dust mites are most definitely there, but think what else you're combining that with that's at home. Suddenly the dust mites and the pet dander and all of those allergens I just talked about are all together in what is now our school place. So that means you need to tackle avoidance of that too. Think of it as a back to school home cleaning on your homework list. And that would go for adults too, because your workplace is now also at home. So start washing the pets, cut down on the dander, kick them out of your sleeping areas, because your sleeping areas and your work areas are really going to be so laden with pet dander. Cover the beds with dust mite covers, put out those HEPA filters, and please be sure that you continue on your allergy and asthma medication, because it does look like we're going to be exposed to this for quite a long time. Another common custom that we have is going with your healthcare provider, and that's that you would have a checkup normally at this time of year, because you would have done it over the summer or the beginning of the fall. Well, this summer didn't really feel like a summer, so a whole bunch of us have missed our yearly checkups. One continuing tool that comes out of our lockdown, though, as Dr. Parikh was talking about, is telemedicine, and that it's really quite widespread, and doctors and patients have taken to this quite well. And I want you to think about those regular checkups being done in a traditional way through telemedicine. Let's talk about the benefits of telemedicine. Well, one obvious one: very little travel time, no commute time. And the way I like to see it is, remember how you used to have to wait for me to come into the office in the exam room, and you're there in the paper gown and I'm running around because the office is running late? Well, we're much better at staying on time when we do it as telemedicine, because all those distractions don't happen to us. And in that point, you also get a much more focused visit. You get my undivided attention, and you can have other people very easily be on that call with you. So you can have more than one person on that telemedicine call plugged in to take that call with us. You can write down all your questions, and you don't have to be feel strange about writing them out and asking me. And I can lead you directly to all sorts of web-based sources to be able to help answer your questions. I think quite a few people have actually used some of our past webinars as well as those kind of sources. So what can you expect from a telemedicine visit? Well, I can get a full medical history just like I always did. And people with allergies can tell me all about their symptoms of itching and sneezing. And I can ask them how long they've had it, and if it's year round, and is it worse around the cat. After I get that full history, I can actually do a full physical exam, or a relatively extensive physical exam, because think of it, I can see your red eyes, I can hear you clearing your throat as you're having your postnasal drip. And when I need to, I can send you for lab work, and all of that can lead me to the diagnosis, which allows us to really participate in that shared decision making. When it comes to putting it all together, we definitely can do that by being prepared, planning ahead, and addressing how you can tackle those allergies in this new reality with telemedicine. And that's really the fun part of my job, is being able to put this all together and then have you ask those questions, and then voila, we come up with a treatment plan. So really, I want you to imagine going forward that so many things that we had done in the office, now we can do via telemedicine. Let's take a revisit of something that Dr. Parikh had shown us, and that is really what are those low-risk treatment types of things that we can very easily do via telemedicine. Biologic therapy is certainly one of those. Those of you who are on these biological therapies know that you have that treatment oftentimes at home, especially for things like atopic dermatitis, and there are certainly some asthma therapies that are given that way, and you can have your follow-up visits done by telemedicine. Immunotherapy, as we've already discussed, can certainly be can be done at home by this sublingual immunotherapy, and those are with FDA approved tablets. So you're not doing something off label, you're doing something absolutely the way the treatment was meant to be done. And we can actually even go ahead and start you oftentimes on sublingual tablets at home, especially if you've had the testing done already at your allergist office. You'll come in and take that first tablet in the office, and then from then on, you're going to have the rest of your treatments at home. We can certainly do an allergy assessment at home, and that would be something really cool where you could walk me around your house and I can take a view of what's going on. Where is the cat sleeping? What does your pantry look like in terms of cross-contamination for your food allergy? Take me down to your basement, show you the mold. Let's talk about how we can remediate treatment because of that. Moving on to medium risk treatments, these are a little higher risk, but we can certainly get them done with a telemedicine visit. And that may be things revolving around food allergy. And while food allergy is that medium risk, the management of it, certainly the diagnosis of it can easily be done via telemedicine. And I want you to think about that, for particularly if you are somebody who missed your usual summertime checkup, that I'd like you to go make that visit now. And I want to put in a plug particularly for something that the network has available new this school year, and those are our food allergy coaches. It's a wonderful program that's done completely over telemedicine. Penicillin allergy is another great thing that we can certainly do with telemedicine, and it's not that we can do the entire workup. Some of it does need to be done in the office, but it's a great place through a telemedicine visit that we can take your history, find out who needs to come into the office to have that testing, and that actually turns what is a medium risk into a very low risk by just getting that history done. High risk for telemedicine, that's absolutely our asthmatics, and what we're trying to do over and over again is decrease their asthma flares and exacerbation. And the way that I propose we do that via telemedicine is by managing and guiding you before that exacerbation hits, so we don't end up needing to have that urgent in-person visit. And here I want to put in another plug for something that we at the network have established, and that is our whole program with asthma telehealth, which revolves chiefly around, we have wonderful asthma educators and asthma coaches that have an entire program to be carried through via telemedicine in order to reduce a patient's risks to handle those flares and those abilities for exacerbations before they occur. Because again, that turns something that's high risk into low risk. So we'll finish up by saying that here's the thing, our lives have definitely changed. We are putting more emphasis on our overall health and especially our respiratory health. We have access to lots of good medical information, just like this webinar, and we're spending more and more time online finding out what works for us. Telemedicine is filling an important space currently for many of us who want to keep up with their health, but they want to do so from home. So our last statement would be that you can have those telemedicine visits, and I want you to think about some of these innovative ways that have already been introduced and make this work for you. I think patients do drive an awful lot of it, of where we're going in terms of telemedicine and managing your own care and having it done at a place that you feel safe and that's convenient for you, and that your allergists certainly are here to be able to provide that kind of service for you. So I will pass it back with that to Tanya.
Great. Thank you so much, Dr. Parikh and Dr. Agari-Sabet. That was really very insightful. We're going to take a little twist and turn to this webinar and actually share with you a great teaching tool about flattening the curve. It's a music education program that was actually developed by Al Keith, a respiratory therapist from Huntsville, Alabama. And so we're going to share that now with you at least a couple of minutes, and then we'll go into our myth versus fact segment.
The world is dealing with coronavirus. It's called COVID-19. People getting sick, death rate is rising. As of yet, there is no vaccine. So far, it's very hard to control. From person to person, it spread. Use a 6-foot rule, even farther would be cool. Just keep it from around your head. Shelter in place. Don't touch your face. We need to flatten the curve. If you're exposed, you may see symptoms between 2 and 14 days. A fever, dry cough, and shortness of breath. It can present in these 3 ways. Even with no symptoms, you can spread it. Use social distancing or you regret it. Just stay home, you won't be alone. Call your family and friends on your phone. Shelter in place. Don't touch your face. We need to flatten the curve. Our world is experiencing a pandemic of epic proportion from a respiratory disease that is spreading from person to person. This disease is caused by a novel virus called coronavirus disease 2019, or COVID-19. COVID-19 is a serious public health risk. COVID-19 is responsible for a number of outcomes ranging from mild or severe illness to its most serious consequence, death. In the United States, the number of reported cases of COVID-19 are increasing with a shape that is going up the curve. This increase in the spread of COVID-19 can only be slowed by a united effort from all of us to flatten the curve. Everyone is in a panic. We are gripped by fear. Pay attention to our experts and listen with an educated ear. Support and applaud our healthcare workers for their courage and their bravery. Coronavirus is real and it's showing us we're one big family. Shelter in place. Don't touch your face. We need to flatten the curve.
Thank you so much to Al. I didn't play the entire thing, but you get the gist of it. This is a wonderful education tool that we have made public and available through our sources at the network, and definitely we would encourage you to share it broadly. Again, we'll provide the URL here, and you can go back and take a look at it, listen to it, and share it, especially for those of you that are in the school setting. It's really important to talk with your students about how to flatten the curve and some of the specific measures that we all can continue to take. So now we're going to go through a little fun exercise of latest facts and myths about COVID-19. I'm going to ask you guys to kind of keep track of your own answers and how many you get correctly. And of course, we'll ask you how you do on our little quote unquote test this afternoon. But no shaming if you get them wrong. All right, so first one, fact or myth? Elderly family members need ongoing support. Absolutely a fact. Look, we know that if you ask them, they'll tell you exactly what they want and need from us during this most challenging time. Support them in the way that they desire to be supported. It's important to help them to have those virtual means of engagement and ways to connect, because again, it's been such a lengthy period of time for isolation and social distancing. Encourage hobbies, activities, interests, and absolutely provide support to caregivers. For those of you who know that you've got family or friends that are taking care of an elderly person, ask to step in and to give them a break and some time away, because it absolutely, after 6 months of such a very lengthy period, we're hearing from more and more people who truly are fatigued. Next, fact or myth? There are no restrictions this year around Halloween. Well, absolutely, this is a myth. So here's what I'll say. It really does depend on your particular area, your community. Different areas are going to have different rules and guidance when it comes to Halloween. So know your area, know what's going on in your community, and especially pay attention to the way that the community spread is occurring. Certainly consider the additional measures of social distancing, and knowing that people often trick or treat in groups, kind of still stay at least 6 feet away if it's not someone that you live with. And then face-to-face exposure, just trying to minimize that as much as possible. And also the handling of the candy, toys, doors, all of that good stuff. So just take those extra safety precautions, have strict rules about social distancing. Don't share your props, toys, bowls, candy, all that good stuff too far beyond those that you live with. Bring hand sanitizer, wash your hands frequently, and try truly not to touch your face. I know this is a bad habit that many of us have, including myself, and I've just become much more aware of the fact that I really need to keep my hands away from my face as much as possible. Next, fact or myth? We can't get together at Thanksgiving. Well, absolutely a myth. Thank goodness, right? Because if you're like me, you love Thanksgiving. It's a special time of year for family and food and just giving thanks to God for everything, all the blessings that we have in our life. So if you want to get your family together, think about specific ways that you can reduce the risk. There are 2 general ways to really approach how to reduce that risk or harm. First, do what you can to reduce the risk of transmission, assuming someone at your gatherings brings COVID along as the uninvited guest. So wear a mask, keep your time together short, improve the ventilation. If possible, be outdoors if the weather's conducive to that. Wash your hands frequently, use hand sanitizer, do everything you possibly can to still gather with your family, and see your loved ones, enjoy that time, but minimize the potential risk of exposure and transmission. And then secondly, with elderly guests, make sure that everyone that's coming to your Thanksgiving table has 0 exposures for 14 days prior to Thanksgiving. So that's November 26th this year. That means that you need to kind of implement this personal pre-holiday quarantine around November 13th to minimize the exposure to those higher risk individuals that are in your extended family. All right, next fact or myth, the pandemic can cause tooth cracks or damage. What do you think? Actually, this is a fact. In a recent New York Times article, Dr. Tammy Chen, a Manhattan prosthodontist, explained that COVID-19 actually can lead to dental fractures. Stress can lead us to clenching and grinding of our teeth at night. I'm guilty of that myself. And then poor ergonomics from working at home can also lead to nerve issues in your shoulders, neck, and back. So what can you do about this? Certainly just being aware of it is the first step. Your teeth actually should not touch during the day. So try to relax, have good posture, sit up straight, definitely take breaks and breathe as you can throughout the day. Also use a night guard if needed, maybe even during the day if you find that this really is an issue for you. Make sure your workstation is ergonomically correct. This has been a challenge for most of us. I think in the first month or so, we were all in denial that we were going to be working from home from any length of time. But now that we know that this is the new way of life for so many, it's important to make sure that your workstation is comfortable and ergonomically correct to minimize any damage to your body. Also, get up and move around. Don't sit there all day. Again, I'm preaching to the choir here. I need to be taking my own advice, but build in those breaks and definitely don't sit for hours upon hours without getting up and moving and getting outdoors, getting some fresh air. And then finally, take a bath and breathe as a bedtime ritual to relax. So before you bed down for the night, it's a good thing to do some meditation, take a deep breath, or even a relaxing bubble bath if you're like me. All right, next fact or myth, COVID-19 can be carried in cigarette smoke. What do you think? This is a fact. In fact, smoking, vaping, and exposure to secondhand smoke and aerosols can increase the risk associated with COVID-19 transmission. Removing your face coverings and smoking or vaping indoors undermines the proven benefit of those face coverings. We know that there's an increased risk in transmitting or inhaling COVID-19 by those droplets, those infectious respiratory droplets. So uncovered coughs, increased touching of your face, these are all things that are often related with cigarette smoking and can increase the risk of exposure for COVID-19. All right, fact or myth, the COVID-19 virus will die when it's hot or humid outside. Don't forget, as we're waiting on this one, put your questions in the Q&A. We're about to start that open session. On this one, it's actually a myth. This has been a myth that has been widely propagated in the media. But from the evidence so far, COVID-19 can be transmitted in all climates. So whether it's hot and humid or cold and frigid, we've seen COVID transmission and COVID exposure in those climates. So regardless of your climate, adopt those protective measures wherever you live or wherever you travel, and be sure, especially when you're in areas with COVID-19 reported cases, that you're more cognizant of the protective measures that you need to take. All right, fact or myth, HEPA filters can reduce COVID-19 virus in a room. This is a fact. When used properly, we know that air cleaners and HVAC filters can actually help reduce some of those airborne contaminants that include viruses in a building or a small space. The reality is, though, by itself, air cleaning or filtration is simply not enough to protect people from the exposure to COVID-19. So you have to use it alongside other best practices that are recommended by the CDC and others, and filtration can be a part of that plan to protect your indoor environment, but can't be the sole plan alone. All right, so how many of you got facts and myths correct? How many facts, how many myths did you actually get correct in the midst of that little exercise? Let's go to our polling system. We'll launch that. How many of you are STAR students and got all 7, 5 or 6, 3 or 4, or you need a little remediation course, maybe less than 3? Some of them were tricky, I have to say. We'll give you guys just a few minutes to answer. The polling in progress, and then we're going to get to your Q&A. So please don't leave. Go ahead and put those questions and answers in the control panel, and we'll get to as many as possible in the last 10 to 12 minutes together today. We'll leave this open for just another couple of seconds. At about 2/3 of the votes logged in. All right. Let's close the polling and share the results there. So how many of the facts in this did you get correct? 33%, a third of our group today actually got all 7 right. Good job. And then it looks like we have a very smart crowd because 62% of you got 5 or 6 and 4% got 3 or 4 and only 1% got less than 3. So I think overall you guys are doing a great job and definitely staying attuned to the fake news versus the real news when it comes to COVID-19 and precautions, as well as our upcoming holiday engagements. So at this time, we're going to go to the Q&A. Please, again, put your questions in the control panel. We'll get to as many of these as possible. So this is a really important question from Lisa, who lives on the West Coast. Of course, they are experiencing terrible air quality. You've been in our thoughts and prayers, Lisa, and everyone out in California on the West Coast. What air quality index would you recommend that asthma sufferers actually look at, or where's that index that they should stay inside? And what about post-COVID patients? Is there a different air quality index number that they should be aware of? Dr. Parikh, you want to address that one first? I think you're on mute, Dr. Parikh.
Oh, sorry. I had lost the last part of the question. If you don't mind just repeating the second half of it.
Yeah, so any numbers specifically about air quality index for post-COVID patients or asthma patients?
Oh, right. Sorry. So, air quality is a very important topic currently, especially if you're living on the West Coast or the Pacific Northwest, given all of the fires that are going on. So if you are someone who does suffer from any chronic lung disease, especially asthma, or somebody who's recovering from COVID-19, as we know, the recovery can sometimes take, many weeks to months, I would avoid, going outside when those air quality index warnings are in effect. So there are 5 different zones of air quality index, and it's measured from 0 to 0 to 500, depending on how dangerous it is that given day. And each 100 increment is a different risk range. And when you're at the highest range, that means it's unhealthy for anybody to be outside, whether it's safe, whether you have an underlying lung condition or not. So what I would recommend is that, if there is anything outside of that green range, I would recommend avoiding leaving your home for anything that's not essential. And that includes if you are recovering from COVID-19 as well, because we do know it does affect the lungs.
Great. Thank you, Dr. Parikh. Next question is for you, Dr. Jackie. So which sublingual immunotherapy tablets are FDA approved now?
So currently there are 3, I'll say, flavors, and that would be dust mites, ragweed, and grass pollen. And the grass pollen is, there's 2 different brands of those that are available.
Right. So the next question comes from Eric, and he asked, if we could kind of speak to the wildfire smokes and with the highest, air quality challenges and the way that that's impacting people in the particular last 2 weeks.
Yes, so I can take this one. I mean, it is a huge challenge. I mean, if you see, some of these photos that are coming out of the West Coast, the sky is a completely different color. So, what the CDC is currently recommending is that, again, you avoid going outside when these levels are elevated, which it has been pretty much all over that area of the country, and you have what they call a clean room in your house where all windows are closed, you have an air purifier if possible, and if you have an air conditioning system, make sure it's not circulating air from the outside into your home. Outside of that, you really should just be staying home. And a lot of the respirator masks that we use for COVID-19, such as the N95s, they have been recommended to use those if you absolutely have to go outside. But again, it's best to avoid it as much as possible. Some places you may have to evacuate, and that, again, you should work with your local health officials regarding that, but you should have an evacuation plan in place, including, you know, a packed bag and your car or method of transportation ready to go. But it is a big challenge, unfortunately.
And I'd add to that, especially when you think about the wildfires, is, you know, when you look up air quality index and you want to know, well, how do they decide what makes it high or poor? It's many of the kinds of chemicals that are going to come as a result of a fire. Is you're just going to have more of these kind of pollutants in the air because of a fire. And then, as we've seen, my sister lives in the Bay Area in San Francisco, and she's sending me pictures every morning. Is there's no immediate fires around her, but the wind blows, and what's blowing her way. And I think we certainly think about patients who have had a COVID exposure and what that may do to them and how they can handle these kinds of poor air quality. But what I had said in my presentation was, I think a lot of us are thinking so much more overall about respiratory health. And that is our patient group, right? That's the group who the network is here for, is those patients with allergy and asthma, that there is such concern about your overall respiratory health. And that's because you have these diseases of allergy and asthma. And it's because of what that does already to your respiratory tree. And then you layer on top of that this increased level of air pollutants, particulate matter, and just the effects of fire. And you don't have to have been exposed to COVID to be at an increased risk, because you've got already sort of a notch against you with your allergy and your asthma and your entire respiratory tree. And by that I mean, you know, nose to tiny little bitty air sac of your alveoli.
Okay, great. So the next question is around what about using UV lights in school? And also the question that's come up every time we've done these around nebulized treatments in schools.
So, you know, I think we've consistently been saying that nebulized treatment should be avoided in schools altogether. Again, if you are, you know, sick enough to need a nebulized treatment, you probably should be staying home regardless, because, you know, even if you don't have COVID-19, but you're having an asthma exacerbation, you are what we call a super spreader, you know. So if you're coughing frequently at school or wheezing, you're more at risk of spreading the virus to others. So, you know, MDIs are best to have on school. Each child should ideally have their own, you know, so there's no cross-contamination. But again, if you're sick enough where you would need that frequently, you probably shouldn't be in school that day. For UV lights, I know there's a lot of data on them, that they are effective. The question is, you know, how you're using them. You know, are you using them on surfaces, shared surfaces? They're a great tool, but it's not to replace disinfecting with soap, water, and the hospital grade disinfectant. So I would say that UV lights should be used in conjunction with those deep cleaning procedures. I don't know if Dr. Jackie has anything additional to add.
Yeah, so what I would add to that is just, again, it's on both sides of this question, it's the back to basics. And, you know, before we go putting all the focus on the molecules that are in the air, the more basic thing is people got to wear a mask. And then what you're breathing in with that mask, you're in a much better stage. And certainly, as Tanya talked about, the business of touching our faces all the time, which is the concern about you're touching the surface, and did you have virus on the surface, and then you touch your face, is with the mask on, especially with kids, that is a bit of a barrier and a reminder. And what I would say in terms of the nebulizers is, I always get concerned when people bring this question up, because nobody's addressing why did we need the nebulizer in the first place? Oh, it's because you've got increased symptoms. Oh, that's because you're heading in the wrong direction, right? You're starting to have an exacerbation. And what are we doing to address that? Is it's not just okay to whip out the nebulizer and that'll take care of everything. It's to take that step back and say, am I not on my maintenance medicine? Is that why I'm in need of having a nebulizer at school at the moment? Or is my maintenance medication not adequate to control me, and hence I need to have a nebulizer treatment or some form of albuterol at school? And if we go back to that first part of how did we end up even needing to talk about giving a nebulized treatment at school that couldn't be given at home, it's because it's needed more urgently. And why is that? Why is your asthma not in good control?
All right, next question comes from Anne, and she says, is budesonide inhalation actually protective against COVID? Anyone seen any data around budesonide inhalation treatment as protective?
Sorry, I was muted again. There is some data actually that has come out that not only budesonide, but other inhaled corticosteroids may be protective. We already know from a very good study out of UK that, in some patients where they were very sick already from COVID-19, that steroids were helpful. But there is some data, especially out of China, that does show that inhaled corticosteroids may help prevent getting, if you do get sick, from it turning into an asthma exacerbation or worse. And it's the same kind of concept that we do for all of our asthma control, right? So if your airways are less inflamed and your asthma is better controlled, you're in much better chances of having a good prognosis versus if your asthma is uncontrolled and you get sick. So, what we've been recommending is that people should be staying on their controller medications, because asthma control is still extremely important.
And I would say just a little more nuanced on that is that this comes up all the time with when you have some sort of an infection. If you add in a steroid, are you actually putting the patient at greater risk? And then comes, particularly with COVID, but steroids are one of the therapies that are used to control the inflammation of the virus. So exactly what Dr. Parikh said, we can really just stick with the basics of what we know is the better controlled your asthma is, the better you'll do.
Yeah, thank you so much, Dr. Gari. So just a couple of closing comments about questions that I've seen that we don't have the time for. Number one, on air quality, you can go to airnow.gov. That's where you can find air quality. Also, remember the hazardous range is over 300 to 500. And then the EPA does have a wildfire course for health professionals on their website. And so you can certainly check it out there. Want to remind you about the Flatten the Curve resource. We will make that available with a link after this to everyone. Also on our website, it has much better quality, not coming through the GoToWebinar site. I heard that some people had a little bit of an issue there. So please feel free to use that in the classroom. School nurses might even consider, doing a student recording or lip syncing as teachers or something like that. That would be fun. And then some questions around mask wearing at school and children who have asthma. We are recommending that if possible, even children with asthma continue to wear the mask. Most, if their asthma is well controlled, should be able to do so in accordance with the guidance. But if they are unable to do so, then again, there's questions around, is their asthma well controlled? What is the impact of that student in wearing the mask and making those decisions? So again, as we come to the close of our hour today, I just want to thank you all for listening. Hopefully this has been helpful, and we're continuing to get creative on how to deliver quality care during the COVID-19 pandemic. Please do consider joining us for our next webinar, which will actually be held on September 23rd at 4 p.m. Eastern. And you can see here, we're going to go back to addressing more of the physical, emotional, relational health and the impact of COVID-19 on the mind-body connection. Again, I want to thank you all for joining us today. I want to thank Dr. Agari and Dr. Parikh for once again giving us such wonderful information. This is Tanya Winders on behalf of the staff at Allergy and Asthma Network. And we once again just want you to know that the network is here every day working hard to help us all breathe better together. Thank you and have a wonderful day.